contains stem cells isolated from the Wharton's jelly and the umbilical cord blood following full-term C-sections out of California hospitals. The Wharton's jelly is the connective tissue within the umbilical cord. Within the Wharton's jelly, you have your mesenchymal stem cells and your mesenchymal stromal cells. Those are the driving force behind the product. Those are the cells that can create new tissue. Within the cord blood, you do have a small number of those same mesenchymal stem cells, but you also do have hematopoietic stem cells, which are blood stem cells useful for other types of conditions. But most importantly, within that blood, you have a high concentration of cytokines and growth factors. Cytokines are like the foreman on a construction site. They are cell-to-cell communication molecules that give instruction to surrounding tissue. Growth factors are molecules which aid your own tissues in either repairing itself or growing new tissue, so it can induce activity in tissue which has been dormant for years. Just an example, so on your left you have your cytokines, on your right your growth factors. The cytokines, again, just cell-to-cell communication. Growth factors, activating the cell cycle to take a cell that's been dormant and make it active again. So how do they work within your body? Now, any damaged tissue within your body, whether that be an arthritic knee, whether that be Parkinson's disease, Crohn's disease, Alzheimer's, it's all putting off a damage signal to your body to try to repair itself. Now, once we have a chronic disorder, our body's not capable of repairing itself after a certain amount of time. But the stem cells still respond to that same signaling that's being given off. So they'll migrate to the point of that signal or the origin of that signal and interact with those damaged cells. Once they've interacted with the damaged cells, they can help rescue a damaged cell from dying or induce differentiation and growth of damaged tissue. Just an example, if your center cell was your stem cell, it can communicate with multiple cells at once by receiving signal two ways between the tissue in your own body and the stem cell itself. So this is where it's going to get complicated. I'll breeze through this real quick. Anti-inflammatory, again, stem cells are highly anti-inflammatory. If you have too many inflammatory molecules in your body and not enough anti-inflammatory, you have inflammation. Inflammation is pain, limited mobility, and a host of other symptoms. We want to flip that balance. We want to give you a lot of anti-inflammatory molecules while reducing your pro-inflammatory molecules. Anti-apoptotic, just a fancy word for when a cell is damaged, your body wants to recycle it, get rid of it, and try to replace it. Our body isn't great at replacing it. This happens in everyone's body all the time. It's not a bad thing, except for when you have all of the tissue or all of the cells in one area all going through this process, and that's how you end up with things like arthritis and other degenerative disorders. So stem cells can take that damaged cell, and instead of letting your body get rid of it, we can repair and try to hold on to it and heal it. They're also antimicrobial. This is great for after surgeries and things like that where infections might be at risk. We've also done everything from treat HIV to valley fever and Lyme's disease because they are antibacterial, antiviral, antiprotozoal, and antifungal. Immunomodulatory, again, if you have a cell in your body which is overactive or underactive and it's causing damage to your own body instead of protecting it, we want to try to restore its normal activity level to protect your own body. A little bit about the government stance on it, FDA, etc. So our product is manufactured in FDA-approved labs. We are approved for use within medicine, but it is considered an experimental procedure, so it's not approved for any specific condition. To date, it's been used for a couple hundred different conditions, ranging from injuries through autoimmune conditions. We all also are the exclusive providers to the Department of Defense, Homeland Security, and the active military. So the government does use it within their own insurance programs. It's just for the general public, it's not approved for any one condition to date. So a little bit about our testing and what we have to go through. So all our products are manufactured in California with about 48 local hospitals throughout California. Now, when a mother is pregnant and going to be having a C-section, she can become part of our program where she's screened for any infectious diseases, as well as mental health conditions, drug and alcohol abuse, and genetic conditions. If she passes and we make it to a full-term C-section and the baby's born without complications, we'll harvest that tissue, the Wharton's jelly, and the cord blood. We'll test that again for any infectious diseases, chemicals, pesticides, herbicides, heavy metals, things that shouldn't be there. If that passes again, we'll go on to production. Production is tested one last time, not only for all of those same things, but then also the dosage. So we want to make sure we have enough live stem cells that can be cryo-frozen and delivered to you. So some of those things that also apply are the currently manufactured processes, currently tissue practices, state regulations, and then the FDA regulation, which is FDA Rule 361. It's a very long piece of litigation, but it is available if anyone would like to read through it. A little bit more about just what I just said. So we can administer the product in many ways. We can inject locally right into a joint for things like arthritis. We can inject it into a muscle or into tissue for soft tissue injuries, neuropathy, and things along those lines. Or we can do an IV. Now for the first two, the only adverse events ever reported are tenderness at injection site, same as with any other injection. If we do an IV, which is a much larger dose for a full body, and that would be for autoimmune conditions, neurological conditions, something like what his dad received. 3% of patients will experience mild flu-like symptoms, except for rheumatoid arthritis and Crohn's disease. Those are a little higher. 4 and 10% of patients can experience mild flu-like symptoms for about 2 days. That's just because we've put in so many new live cells into your body, we've overwhelmed your immune system a little bit, and it's elicited a mild fever. So here's what people are more interested in now. So you're looking at an arthritic knee. Now this is a 7-year follow-up study. I'll try to do my best to explain this, but on the top left is your before picture. You can see this white mark right there, and then a little bit here and over there. That's the only cartilage that's left in that knee. That, for all intents and purposes, would be someone who needs a total knee replacement and is completely bone on bone. You can look as time progresses. At the 7-year mark, they put a dye into the knee, and it's looking for a molecule called GAG, which is the indicator of healthy hyaline cartilage, which is the type of cartilage that should be found in the knee if you're not arthritic. This blue indicates presence of GAG. You can see the cartilage regrowth that not only was accomplished through one injection into the knee, but also maintained at the 7-year mark. So once we regrow tissue, it is live tissue, it's your own tissue. Now, will it degenerate over time again? Of course, it's not superhuman, but it will only degenerate at the normal pace. So that can be years or decades for that knee to ever get back to the original state. Rheumatoid arthritis lesions. So some of these pictures, bear with me on some of them. I know some of them get a little graphic as we go on, but not everyone that has rheumatoid arthritis has these lesions. But what is important to take away here is that rheumatoid arthritis is treated through an IV. It takes about 10-15 minutes to do. But this shows that the cells can migrate throughout the body, repair not only the lesions, but the rest of the immune system which caused those lesions. So this is a 6-week before and after picture. Burns, wounds, it was actually the first thing that the military was interested in when we first began talking to them. Not only is it impressive that the burn was healed in just a few weeks' time after local application, but what's also impressive is that if anyone's seen a burn as it heals naturally, it has a pretty nasty scar. And you can see that in just a few weeks, not only is it healed, but it's healed with very minimal scar. It also, because it's antimicrobial, it'll also help prevent infection in these cases. So it's used in burn units from everyone from Cedars-Sinai, Mayo Clinic, Cleveland Clinic, and several other large hospitals around the country. Psoriatic arthritis, again, autoimmune disorder for which intravenous administration. Showing 6 weeks later, not only is the lesion completely cleared, but the arthritic symptoms in this case would also be completely cleared. Crohn's disease, ulcerative colitis. So on the left, you have the intestines or the colon of Crohn's or ulcerative colitis patient. Now this one's close to my heart because my little brother was diagnosed with Crohn's disease when he was 9 years old. At 19 years old, he weighed 110 pounds, but he was 5'9". He was losing his hair and his nails. He had 12 to 14 bowel movements a day, blood in almost every one of his bowel movements. Now, we gave him one IV to start. He ended up having 2 IVs because of the severity of his condition. But for my brother, within about a week, his bowel movement frequency had dropped from 14 a day down to 1 to 2. After several weeks, there was no more blood in any of his bowel movements. It's been 2 years now, and he's gained 58 pounds. So his body is no longer completely scarred and damaged on the inside. He's able to absorb nutrients. And this is showing a 1-year marker for 2 other Crohn's and ulcerative colitis patients. You can see on the left the swelling, the inflammation, the blood, the growths inside of the intestines. On the right, you can see that it has completely healed. There are 10, 15, and 20-year follow-up studies for things like Crohn's and MS, which show that the results last with minimal incidence of flare-ups along the time. MS. So in the red box on the left, we're looking at your spinal cord. Now MS is multiple sclerosis. You can see the spinal cord is supposed to be a clear black tube with a white layer on the outside. Think of it as an extension cord. You have your insulation, the rubber on the outside, and the actual cords running through the middle. That white marks on the inside of the black tube is the scarring of the spinal cord, which isn't supposed to be there. You can also see there's holes in the insulation layer and a lot of swelling and misshapenness. 56 days after the first treatment, you can see we've greatly reduced the scarring on that spinal cord, and your insulative layer is more or less healed at this point. Now, MS does usually require a couple of different administrations to get someone who, in my case, one of the first patients I ever actually personally saw treated, other than myself, was an MS patient who had been wheelchair bound for 4 years. She couldn't move her legs left to right, she couldn't flex her ankles. After 2 rounds of treatment, after extensive physical therapy, because she didn't have to relearn how to use it, she was able to walk across the room and get me up. Now, it's not easy work, because just because I can get rid of the lesions doesn't mean your body knows how to now use those new nerves we've regrown. So it does need to be paired with things like the PMF and physical therapy in order to accomplish full results. But we've seen Parkinson's patients stop shaking, we've seen MS patients walk. I have 2 ALS patients who have had ALS now for 10 and 12 years, which is 2 and 3 times longer than the average ALS life expectancy. Autistic children who were kicked out of schools because of violent behavior, because they couldn't integrate into the normal school system, were able to be treated and go back to normal school. So, and that's part of a Duke trial that was in the news a couple years ago now. So, been quite a lot to date. You're going to see, if you'd like, you can go to clinicaltrials.gov. That'll show you any active study or active trial being done within the US or globally. There's many more probably than even the 5,300 here listed. It's constantly going up as it's something that every major university and hospital is investing a lot of time and energy into. This is not an exhaustive list. There's another slide of this, but if anyone has any questions, I'm happy to answer a few. Well, that's it for me. I'll be here for a few more minutes. Dr. Tanner,